Hey, Dr. Fox, and I just want to take a few moments just to talk about a presentation that I have coming up on October 18th, and it's called A Comprehensive Look at the Modern Depression. And this is for mental health providers, but I do think that other people might be able to benefit as well, because I think depression is impacting so many of us in so many aspects of our lives, which is what this presentation will focus on. So what we're going to do is we're going to also, in this presentation, we're going to talk about depression over the last 40 years and how it's changed and how the mental health field looks at it and is managing it. Now, we're also going to move into this, are we treating a new kind of depression? And this is because I really think that depression and our expectation and understanding of depression has changed a lot. And I think a good lens is through emotional intelligence. And the research shows that there's been a decline in emotional intelligence. And what we're going to examine in the presentation is, does that factor in to depression? Because if you think about depression, right, it's more than just feeling sad, down. It's this hopelessness, helplessness, worthlessness. But how much of it is also the inability to recognize emotions, manage emotions, and perceive emotions accurately? And that's where the lens of emotional intelligence can be really, really valuable. Now, we're also going to talk about depression and the common comorbidities. And this could absolutely be ADHD and other facets, even, as you know, personality and personality disorders. So we're not just going to look at depression as if it's on an island. We're going to look at depression as if that island has all these bridges going to it, and that there are all these other comorbidities, problems, and issues associated with it. Now, as we look at it, we look at those comorbidities, we look at other facets of this new kind of depression. We also have to look at, well, what about age, gender, and how that impacts depression? Because that's really important too. And there's a lot of good research that helps us understand this. And as a mental health provider, it helps us understand and really conceptualize what could be going on with the individual from that age and gender standpoint. Because there's so many different facets and vantage points for us to consider. From this, we're also going to look at depression, social media. We got it. Social media, people say it's here to stay. I don't know, in one form or another, I think it is. But how does social media impact depression? And when we look at it through a lens of emotional intelligence and depression and social media, do we see that there's a greater degree of impact? And there are many impactful facets here that absolutely can add to depression, exacerbate it, make it worse. But can we also use this to attenuate some of those depressive symptoms as well? We're also going to look at, and this is something I talk to my clients about a lot, that depression is also paradoxical. And when I say paradoxical, it's because, right, so depression, in order to get over it, you need to have energy, insight, and drive to get over it. But depression saps all of those factors and makes it exceptionally more difficult. So as a mental health provider, we have to look at that. We have to say, wait a minute, if it's paradoxical, how do we work with it? And how can we utilize this framework in order to be more impactful as mental health providers and also build your understanding and insight as an individual with depression? Now, we're also going to focus on what's called treatment-resistant depression. And I know my face is over that title there, but that's what it says. And treatment-resistant depression, I think, is very common. We're going to define it. We're going to look at various facets. And because I think, again, as mental health providers, but also perhaps as an individual who's struggling with this issue, that we got to understand this treatment-resistant depression and what identifies it, right? What factors into, but then what are perhaps some other treatments that we can utilize or you can utilize to help your clients or help yourself? There we go. Now, we're also going to talk about efficacious treatments, right? What are evidence-based treatments that you can utilize in order to be impactful and help yourself or your clients to manage those depressive issues, that hopelessness, helplessness, worthlessness, fatigue, sleep difficulties, and other factors. Also, we're going to break down the process of treatment, my process of treatment, as to when I see a client that has depression, and depression is one of those major comorbid factors. What's the process of treatment? How do we look at it? And how can we be impactful to help that individual change and feel efficacious to lessen the impact of that depression? And I think that this presentation, certainly it's going to be geared specifically for mental health providers, but I think that if you're interested, that people that are dealing with depression themselves, or that maybe have a partner or family member dealing with depression, may be able to get something out of it too, because I think the more we know about depression and this new modern depression and what factors into it, the more options we feel we have, and the more options you feel you have, then that is more inroads in order to help yourself, to help your client, and to help others manage depression more effectively. So I hope to see you there. Please look in the description. I'll put a link for the seminar, and I hope you'll check it out. Thanks a lot. Bye-bye.